All right. Hi, everybody, and welcome. And I feel very, very blessed to have a wonderful human here to help us understand a little bit about the mental health aspect of the pre and postpartum period, which is extremely important because, you know, every woman's experience is different and every person's experience is different, whether it's the mom, the dad, and I think, and even the children in the household. And so I feel like given this time period, especially around COVID, there's been lots and lots of people who have reached out, thankfully, but also women that I even see in my clinic that, you know, are having concerns around, you know, how they're feeling about things and what this might mean and where they can find some help moving forward. And with COVID, you know, a lot of it is around, you know, oh, what's going on out there? But I think the conversation needs to kind of drift in the direction of, okay, well, what about everybody's mental health around this? And I mean, that should be, you know, in place regardless of the times. But I think given the times, we really need to start addressing and supporting each other and empowering women to reach out and get support as well, and people. So one thing that I want to kind of just start off with is that, you know, this, you know, kind of perception that, oh, mom and baby are doing fine because everything just went great. And really and truly, that's, you know, not necessarily that individual's story. And, you know, a lot of women go to their 6-week checkup. Oh, you're fine. You're perfect. No problem. Move on, right? Get going on your exercise or whatever. And, you know, women the focus is more so around the babies. And I think we need to change that as well, because, you know, it prioritizes the babies. And this is sometimes at the expense of the mother. And so, you know, I really am excited to give you guys an opportunity to have a listen as to what Jen does and what her company supports. And yeah, so let's get to it. Jen, can you just tell us a little bit about yourself, and welcome.
Thank you. Yes, thanks for having me. This is so great. I'm happy to talk about this anytime. So my name's Jen, and I am the founder of the Motherhood Project. We offer perinatal wellness support is kind of the best way to frame that for moms. So perinatal meaning during pregnancy, and then of course postpartum, and then even beyond, we're supporting mothers. And we do that through a few different lenses. So we offer fitness for prenatal, postpartum, mom and baby classes. We offer yoga. We offer various like workshops and collaborations with other allied professionals. And then we also offer free to the participants, free mental health support groups, which is a big passion of mine. And so, yeah, we're trying to be a really holistic and full spectrum kind of a place or a hub for moms to be able to go either for direct access to things or our referral network, which is quite great. So yeah, that's a little bit about the business.
Awesome. And Jen, just a bit about maybe, you know, yourself and your experience, because I know as we've talked, being friends and colleagues, that, you know, we all have really found ourselves in a place sometimes where we do have, or are struggling with some of the mental health aspects, but with a different story and a different background to it. I mean, I know for myself, I kind of just found out last year that what I had been experiencing for a couple years was actually postpartum anxiety. And I mean, yeah, my daughter's 3 now and my other kids are much older. And, you know, that was quite profound for me.
Yeah, absolutely. So I am a mom of 3 and their age gap is kind of big, but I have an 8, 6, and 1-year-old. And so I got into this work back when my daughter was born, I would say. And so similar to you, I had an experience where with her, I didn't realize it until afterwards, but definitely the first year of her life, I was like definitely struggling with postpartum anxiety. And I just wasn't aware of it. She had a bunch of like health things that were going on, like plagiocephaly and food allergies and just a number of things. She was a fussy baby. And I feel like I should have known, right? And we say like, oh, I should have known, but it just wasn't the case. With my oldest son, everything was pretty good. I do have a history of anxiety and depression from, you know, before having children, which is always, you know, a risk factor for future struggles with mood. But first baby was pretty okay. So second time around, I just wasn't really paying attention. And I think there just wasn't enough even information within my own support system of like what to be looking for or like what some red flags might be. So yeah, I definitely struggled for a good year. And then once I got into the business, so I'm a personal trainer, I'm a yoga instructor, I'm a pre and postnatal fitness specialist, you know, working with moms and being exposed to moms every single day, you really kind of you start to see what the landscape looks like and how, you know, some things are really glaring examples of people who are struggling, and then some aren't. Sometimes it's like the mom who seems to be doing very well or has it together. And once you kind of get under the surface a little bit, you discover like, oh, actually, you know, she's struggling too. Yeah. For my own experience, so my third baby, he's 1 now. I think I'll probably just call him the baby forever, but he's 1, and our journey to have him involved multiple pregnancy losses. So we had 3 consecutive losses in the span of a year, which, you know, while you're going through it, you're just in this whole other experience. And then what subsequently happened was with my successful pregnancy of Blake, it was just such a different experience. So I had a lot of anxiety. So we would call that a perinatal mood disorder, where a mom is struggling during pregnancy, which is very, very common and not spoken of enough. But your history, your background going into pregnancy really does or can play a role. And so I had a lot of that going through the pregnancy. Was it was traumatic. I would say, like, I was dealing with trauma from those losses. And then right up into the point of even having him, giving birth, it was still like, I don't know if I can trust that everything's okay, right? Even though I have this baby. So yeah, a lot going on. It can be a very complex time. And it's a lot to navigate. So for me, it's my profession. So I have all this kind of background knowledge and training. And for me, I was aware of it, but it was still a challenge. So my heart really goes out to moms that are thrown into these scenarios and they don't have resources or they don't have the information going in. And it, you know, sets us up for a really challenging and scary time.
I'm assuming that would relate as well to people who have struggled with infertility.
Absolutely.
And, you know, maybe even, you know, health issues like endometriosis and PCOS and stuff like that. And yes, they may eventually have gotten pregnant, but it's just that whole history of, you know, even pain and, you know, that can often drive that as well. So thank you for putting that out there with respect to, you know, the perinatal mood disorder stuff. Cause I mean, you know, that can drive a lot. So, you know, thinking about that and then moving from that sort of prenatal period. So what kind of things, you know, in that first, you know, 6 weeks time period we kind of look for, and what's important to kind of reflect on, or something that, you know, even our partners may be able to recognize that may be able to then facilitate support or find support, right?
Yeah, absolutely.
And maybe even have some resources at the end.
Yes, for sure.
Yeah.
So I find that the most success comes from when you have a built-in support system, whether it's your partner, if you have a partner, or it could be close friends, or it could be family, but someone who is in it with you, who knows you, who can kind of assess where you're at. Because if you are struggling, oftentimes we don't have the self-awareness, but someone who knows us really well can see that we're struggling. So that is number one, having people around you that know you and can support you, that you can talk to. I really do encourage people to sort of track their experience, track their emotions, to see how things are going. Because what typically happens, and is very common, up to 80% of women are going to experience the baby blues, which happens as a result of the hormone adjustment after giving birth. So that can look like depression, but it's a temporary time period. So technically they say like up to two weeks, you could be feeling, you know, weepy, emotional, sad, or down. I even say, you know, give it a month to see how you're doing. If things are not improving, if you're still feeling down, emotional, disconnected from the baby, or you're feeling anxious, I wouldn't say can't sleep well, because I mean, who's sleeping well with a baby, but
role.
just that feeling of not being able to like let down, like to actually rest. It can be a sign that, you know, things are maybe going a different way. So if you're able to monitor your feelings and where you're at, then you can see, like, are things getting better, or does it seem like my symptoms are either staying the same or getting worse, which is when we would then talk about, you know, potentially you have some postpartum anxiety or depression going on, OCD, post-traumatic stress. Like there could be many things that persist. So if it's beyond that 1 month mark, I would say, you know, that would be a good point to check in with someone. An important piece of this is that usually mothers, especially now during COVID, the amount of attention that you have on you, like you mentioned, it's not much. And you're waiting potentially 8 weeks before you're going for a checkup with your physician or your OB. If you have midwives, they might be coming, or if you have a postpartum doula, they you have more face-to-face access with someone. But there is a gap, which I have a big problem with because a lot happens. In 8 weeks, a lot can happen. So if someone is struggling and things start to get worse, it's persisting, it's getting worse, and no one is checking in or talking to you, it can really be a very scary time. And 2 months, 8 weeks is, in my opinion, it's just too long to be left there to just figure it out or just deal with it, right? When you don't know what to do.
Well,
so
interesting you say that, because I've had a lot of moms reach out at 4 weeks postpartum.
Yes.
And I mean, I feel like that is that point, right? And they're like, I'm not at my 6 weeks yet. And I'm like, no, hold on a sec. Like, let's have a telehealth session. Let's just check in for, 30, 45 minutes, even an hour, right? And let's just see how you're going and how you're doing. And we can talk about some of these things. And I totally agree. We need to have that, especially now, that like midpoint check-in that you're not going to get with, necessarily with your midwife or your doula, because that 4 weeks is already gone. And then, I think that's also where you could come in, or where we come in as pelvic health physios supporting that population. Yeah. And so for me, a large part of my business is also because we're personal trainers and we approach the physical aspect and kind of returning back into activity. A big part of our work is sending people to you for referral, and you're also like a check-in point. So what I would say is, oftentimes you might get a phone call. I think public health is doing phone calls, although some people I've heard lately are not getting the phone calls. No, they're not. They're getting like a little checklist that maybe they should look at and see. But my biggest piece of advice would be, if you're not feeling like yourself, and you are beyond 2 weeks, 3 weeks, and you're still feeling, I've got a whole list of symptoms we can run down, but you're not feeling like yourself, then check in with someone. You can call your doctor and say, hey, I need to check in sooner than 8 weeks, right? Or you can reach out to someone like myself through the Motherhood Project. In our support groups right now, we have new moms, like 2 weeks post C-section. They've just given birth, and they know they need support. They know that they're feeling overwhelmed, or they know their birth experience was traumatic. It wasn't what they were anticipating. There's a lot of that happening with COVID, where just your experience is different than what you had maybe imagined. And so there is help and support way before your 8 week mark if you need it. And even just checking in, when we have support groups, it's peer support. So we're a number of women all together, and you're talking to other moms, and they're saying like, yes, I'm going through that too, or I've been there too. And it's really important to develop that community and that support. And sometimes having people that you don't really know, like in terms of a support group, it's a bit more freeing. It's a bit more liberating. Women can kind of just like, really share the truth if they're having difficulty, sharing with their partner, or sharing with a parent or a friend. So there's absolutely resources available. And I would encourage you, the hardest part is reaching out, right? Like that asking for help, but there's no shame in that at all, especially as a new mom. Like, number one is you need to take care of yourself, right? We always say, like, put on your own oxygen mask first. Yeah, but we need to be doing that, but we don't, right? So
we need to change the landscape of things a little bit there.
Yeah.
I'll give you a few common symptoms, like
Awesome.
things to look out for maybe. Yeah. So this is sort of for any kind of postpartum mood disorder, and it could also apply to a perinatal if you're pregnant, mood disorder. But obviously sadness, crying for no kind of apparent reason, a lot of worry or agitation. Hypervigilance is a common one, where we're really worried about the baby, checking on the baby. A little bit of that is normal because, they're new and you want to check. But if it's kind of consuming you, if you feel like driven, like it's something that you have to do, that's where that little bit of like OCD comes into play. Postpartum mood stuff can look like anger. It can look like irritability. If you feel that you're like lashing out or you're extra kind of like hostile towards your partner, that's a sign, that's a symptom that there's more going on. Feelings of guilt, feelings of helplessness, feeling of overwhelm, that is a big one. And like that counts. People tend to just like feel like they should be able to deal with, all these overwhelming things, right? Like I should be able to do this. I'm a mom. I should be able to be a mom, but we really need to pump the brakes on that line of thought, because it's a slippery slope and it gets us into unrealistic expectations, right? Which then leads to more guilt and shame and feeling bad about ourselves. So you might have a lack of connection with the baby. Like you might feel like, I don't know, I thought we'd feel closer. I thought I'd feel more, loving or engaged. You might have that same type of disconnect with your partner. Just not feeling engaged is a common one. Like I mentioned about like the mom who looks like they're seemingly very, very well. So if you're like cleaning a lot, if you are taking care of all these house chores, if you're socializing, if you're, right? Like it's kind of the opposite of what you would stereotypically picture, but that overactivity, that like, go, I can do it all. I'm going to do it all. That's a sign of, it's like an anxiousness, right? This drive. I don't want to say manic, because some people do deal with like mania, and that's like that's a bit of a different level of things, but it's that urgency to get back to your go, busy. I'm going to do it all. And I'm going to just have the baby coming along for the ride. Right. Yes. So that's a common one that gets overlooked a lot. Right. So we always say like, check on your friends who are doing well too. Ask them how they're doing.
Exactly. Yeah. And they're looking well, and they're, seemingly.
Yeah. Or if they're very well put together, like they're doing their hair and their makeup and they're, yes. So that's a common one. Yeah. And all of this stuff is so common. Yeah. That's another big piece of our education, is that like, you are not alone. Like, absolutely. And in my work every single day, it's just like a testament to that. When we get together with moms, so you're not alone. It's quite common. So just statistically, I said like about 80% of women will experience a mood disorder. Beyond that, when we're talking about postpartum, it can be up to 20% of women who are going to deal with a legitimate, more severe escalated mood disorder. So yeah, it's a very common thing. Yeah.
And I think that looking at that as well, like, there are numerous resources out there for sure. And, a lot of people obviously are exploring options on social media and whatnot at this point because it's easy. But I think, finding the resources that are supportive, legitimate, where people are trained to deal with these situations, or also really well informed, and then can refer to the appropriate person for them, is really important too. And I know that personally, you may not get along with that one resource.
Don't give up.
So don't give up. Like, there's lots of other options out there as well. And I mean, in Australia, they have the birth trauma organization, and they have phenomenal resources. Yes, it's in Australia, but you know what, they you know, the founder is really great about, you know, trying to find options elsewhere. And then of course, you know, your company and,
Mhm.
you know, even us as physios, I have my background in psych, and I feel like, you know, I do have a great referral base as well. And
Yeah.
I know that tons of other pelvic health physios do as well. So just even, you know, reaching out to the people that you may even be seeing already.
Yeah. Do you want me to give a couple different resources? Like just,
yeah, can you just throw some out there just so that
yeah.
people may be able to go and search?
Absolutely. So where I am, like I'm in Delta, and I mostly am seeing women in Surrey, Delta, White Rock. There's a number of resources, and a lot of places are online and available to do like a telehealth check-in like this. So for us, our support groups are online right now over Zoom. So which is great for new moms, especially if you've had a C-section or you're recovering. You can just show up in bed and, you know, feed your baby or whatever you need to do. It's actually like, it's pretty brilliant.
Yeah.
But above and beyond that, so my training as a facilitator is through the Pacific Postpartum Support Society, which is an amazing resource. So you can just phone them. They do phone support, text support all the time. If you are feeling as though you are struggling, that's a great place to go. Reproductive mental health here in Surrey has like an avenue. And then there's also another branch of that through BC Women's, which is, and I hear kind of, you know, mixed reviews about both. And that sort of just speaks to the be persistent and find someone that you connect with. Cause I see lots of moms tell me like, oh, I had a really negative experience. Like, I don't think I can do this. It just might not be the right fit. Like anything, you know, like a fitness trainer, like a physio, like anything, you want to feel safe and supported and heard. And so if you're not feeling that way and you just don't like connect, it might take 1, 2, 3 tries, which can feel a bit like defeating in the moment. You feel like, oh, like no one's going to be able to help me, but they are. You just need to find the right fit. And there are lots of counseling options available for women who are going through postpartum stuff. That, you know, kind of gets into maybe you're not going down that road until a little bit later once you've tried to like get through the hormonal part, assess what's going on, and if things are kind of escalating to that point. But we are like the gap fillers, you know, we can be there to help and then to sort of say like, hey, yeah, keep doing this. This is a great level for you. Or I think, you know, maybe you should check out this or check out that. So it's important to find people that are trained and, you know what they're talking about.
On my point, I really think it's important to kind of make sure that your resources are very legitimate, right?
Yeah. So I'm not to knock like just community. There's tons of like Facebook groups and community groups and that's wonderful, but just consider also where you're getting your actual advice from, right? And what you're doing, because that can look very different from like someone who's, you know, trained in it, or like I'm certifying as an infant and pregnancy loss support person. So a lot of people will share stories about their miscarriages and losses, and that is a very powerful thing. But if you need help processing trauma, or you need, you know, more legitimized, I use that word kind of loosely, but there are people who specialize in that, you know, like this is a facet of my work that I'm like dedicating training to because it's so important. So know your resources also ahead of time if you can. So in pregnancy, if you can figure out a few go-tos before you get into a situation where you need them, I always say that's a great preparation plan. You might not need it, but if you do, you've already done the legwork of figuring out who they are.
Absolutely. And I mean, in my prenatal visits with my patients, I always talk about those sorts of things as well, just to ensure that they're there if it's needed, but you don't need it, then that's fine.
Exactly.
So on that note, thank you so much, Jen, for talking about
pleasure.
About all this with us. And we hope to continue to develop this conversation for women and help everybody kind of feel empowered to seek, you know, support and be able to, you know, get through these postpartum days, which, you know, sometimes seem short, but looking back, but sometimes seem very long when you're in the moment. Yeah,
absolutely. Yeah.
Well, thanks again. And
thanks so much. Anytime.
We'll post your contact in our little community as well. And
Perfect.
So that people can get in contact with you for your groups moving forward.
Sounds
Thanks,
great.
Jen.
Yeah, thank you. Take care.